Hello dear patients, today we are going to review the case of herpes on a thigh. As it often happens, patient came to our clinic after he diagnosed allergy in himself. For quite a long time, for 10 days, he used different hormonal ointments. Most commonly, these were elocom and sinaflan, and as a result, rashes even increased a bit. It started to itch quite intensively, although earlier it didn't induce any discomfort. Apart from that, his temperature started to raise in the evenings to up to 37.5 degrees. After that, he stopped self-treatment and searching the internet about what it was, and he decided to consult doctors. So PCR analyses were taken from the surface of rash for 3 types of herpes, first, second and herpes zoster. Blood was taken for syphilis and HIV. Also PCR was taken for streptococcus. Apart from that, culture test was taken from the surface of rashes with sensitivity to antibiotics. As a result of that, syphilis and HIV were negative, and the positive herpes zoster came from the surface of rashes. Herpes zoster is also called shingles, and in some cases it starts from relatively small rash, as it was in our case. Later on, analyses were taken for herpes zoster in blood and for antibodies to it. As a result of that, positive immunoglobulins G and M were found, and a positive PCR analysis for herpes zoster in blood. So, a diagnosis of herpes zoster of thigh area was set. Antiviral therapy was prescribed in the form of valtrex medication in dosage corresponding to herpes zoster. Immune medications by type of ozone and cycloferone were prescribed intravenously and intramuscularly. Also, antiviral ointments were prescribed by type of panavir gel and acyclovir cream. After 10 days of treatment, rashes resolved almost completely. Positive PCR analysis for herpes zoster disappeared from blood, and this was confirmed by blood analysis. The patient was taken for dynamic observation, and during it, external manifestations are observed as well as level of immunoglobulins G, M and A for herpes zoster. This case indicates that you shouldn't think of different skin lesions as a simple allergy. Analyses have to be done, and only they can confirm or deny some diagnoses, as even small rashes can be a consequence of some significant infections. Self-prescription of medications, including external ones, can only harm, and this was noted in this case. If it is necessary to diagnose and treat skin diseases, you can consult dermatologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of different infectious and non-infectious skin diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.